What's up, everybody? I'm Bryan Brozy, Doctor of Physical Therapy, B.Well Physical Therapy and Wellness, co-host of the Well Man's podcast. Today I'm going to be demonstrating one of my favorite spinal stabilization exercises, the bird dog. The bird dog can be done improperly, and it can be done very, very properly and have a great benefit to our overall spinal stability. So, whole point of the bird dog is to create motion in our ball and socket joints, our shoulders and our hips. However, we want to minimize, this becomes a low back exercise, by minimizing the mobility or motion that occurs from the ball and socket joints, but minimizing the translation of that movement throughout our spine. So we want to keep a nice, stable core the whole time. Some cues that I use to remember that: sucking our belly button in and up is a great cue to engage the transverse abdominis, but I also like thinking that someone's going to come poke or punch you all around the core, which includes our low back here, but particularly in the front and in our obliques and in the front here, keeping nice and tight throughout that whole core to maintain that tightness and abdominal bracing throughout the entire exercise. So I'm going to demonstrate a few reps of the bird dog here, and before I even show you a full bird dog, I'm going to show you what I start with, which is just, I call it the multifidus leg slide, but it's really just a bird dog where you're kicking your leg out only. And I like to start there because you can get a little bit more, you can put your hand on your belly and then get a little bit more feedback on how well you're maintaining that contraction, and also just focus on one ball and socket joint versus the other one. Because you'll notice if you're doing this right, it is difficult. It is very hard. It is very involved, and you'll feel like you are working very, very hard and break a sweat easily with this exercise. So for overall positioning, I want my hands directly under my shoulders. My knees are going to be a little bit wider than hip distance apart, but they are stacked, at least in line. They're wider than my hips, but overall positioning, they're still under my hips. I do have my feet tucked. And I'm going to go ahead and begin to kind of play with my spinal posture here, find a nice neutral core through these cat-cows. Again, knowing neutral spine, and neutral spine has some natural curves to it. Then I'm going to suck that belly button in and up, prepare for the punches that are coming to my gut. Pull my shoulder blades down and back, almost like I'm trying to bring the mat with my hands or fists towards my knees, and the opposite, same thing, but the opposite direction with my knees. So I've created really tight abdominal bracing here, and I'm gonna kick my right leg out, hold all the way up to 6, 8, or 10 seconds, let's say 8, 9, 10 right there. Bring, while maintaining this tight core, bring the hip in. 7, 8, 9, 10. Good. And I'm going to switch sides just to demonstrate. And before I do, I'm going to talk about a cue that I like to use a lot in clinic. So in clinic, I'll either cut out a half of a foam roller, use a book, furniture slider, really any piece of equipment will work. And I'm going to place that between my two PSISs, two bony prominences, my hips. And this is useful because it's going to give you some feedback as to how much motion you're getting through your hips, or if you're doing any compensation, kind of like tipping like this, right? This is not a stable core. If I engage my core, you notice how my hips become inlined, and now that furniture slider is hopefully a lot more neutral on my back. So that's a great way to kind of self-assess or be aware of how much motion is going through your hips. I'm going to show you on this side, moving this leg. Hands stacked under the shoulders, knees under the hips, but they are a little bit wider in hip distance apart, feet tucked. Brace. Keeping this core nice and tight, moving only the ball and socket joints, and kicking back out. 6, 7, 8, 9, 10. Really bracing the core, really getting tight within, like we're holding, preparing for a punch that could be coming in on all sides, all directions of our core, and still maintaining deep breathing into our core, which is one of the hardest parts. I just want to demonstrate, because this is how I was doing bird dogs before, very lackadaisically, and here you're not getting the benefit. You'll notice a big difference between what you just saw and what I'm about to demonstrate. So I've seen and I have done bird dogs, right? Woo, working hard. I'm doing them, I'm working my core. Hopefully what you pick up between that and that are two very different exercises. One is not going to get you very far in your back training or your core training. It may actually exacerbate your back pain, versus that second one, the last one I just demonstrated, is a lot more creating that core stability and really helping develop that nice tight core. And again, this exercise is about minimizing the motion, as hard as it is, minimizing the motion in the lower back and in the spine as a whole, despite the ball and socket joints moving throughout a large portion of their range of motion. Again, my name is Bryan Brozy, Doctor of Physical Therapy, co-host of the B.Well podcast, and until next time, be well.